Shortness of breath? Man, it's a feeling that can range from just a little annoying to absolutely terrifying. For a doctor, it's this high-stakes puzzle they've got to solve, and they've got to solve it fast. So let's dive in and crack the code on exactly how they do that. So, you're feeling breathless. Is it just that you're a bit out of shape? Or is this a full-blown medical emergency? Figuring out how a doctor tells the difference is so important because, in some of these cases, the clock is seriously ticking. All right, the second a patient comes through those emergency room doors, the clock starts. And in those first few minutes, there's really only one question that matters. Is this person stable or are they unstable? Right away, doctors are hunting for three huge red flags. First is their oxygen level below 90%. That means the body just isn't getting the fuel it needs. Second, are they breathing more than 30 times a minute? That's the body working way, way too hard. And third, any confusion or drowsiness? That's a sign the brain itself isn't getting enough oxygen. You see any one of those, it's a 5-alarm fire, for sure. And when that alarm sounds, the response is like clockwork. It's immediate and it's methodical. Step 1, boom, get them on oxygen right away. Step 2, run the most urgent tests, like an arterial blood gas to get a super precise reading of their oxygen levels, and a chest x-ray to literally see what's going on in there. Then, step 3, use that info to start treating the real problem. There's no guesswork here, it's a straight-up life-saving protocol. Okay, but what if the patient is stable? I mean, they're not comfortable, but they're not in immediate danger either. Well, this is where things get really interesting. This is where the doctor basically becomes a detective. It's time to start gathering clues. And every great investigation starts with two main sources of information: the story the patient tells you and the physical clues their own body is giving up. So the first question is almost always about timing. When did this start? See, if that shortness of breath hit you suddenly, just completely out of the blue, a doctor's mind is going to leap to some really dramatic possibilities, like a blood clot in the lung, a pulmonary embolism, or even a collapsed lung. Next up, do you have any chest pain? And it's not just a simple yes or no. The type of pain is a massive clue. Is it sharp? Does it get worse when you breathe in? That could be another pointer towards a blood clot. Or is it more of a crushing pressure, something that gets worse when you move around? That's textbook for a heart attack. See, the details are everything. And this is where you really see how interconnected the body is. A good detective looks for clues everywhere. Got a fever and a cough? Okay, that might be an infection like pneumonia. What about swelling in just one leg? That is a huge red flag for a blood clot that might have broken off and traveled to the lungs. It's all part of the same big puzzle. So after hearing the story, the doctor starts listening to the body itself with a stethoscope. This is all about matching physical clues to suspicions. That high-pitched wheezing sound, that screams narrowed airways, like you'd find in asthma or COPD. What about crackles? Sounds like crinkling cellophane. That could be fluid in the lungs from something like heart failure or pneumonia. They'll even look at the veins in your neck. It all tells a piece of the story. All right, so we've got the patient's story, we've got the physical clues. Now it's time to, look under the hood. The detective is opening up their toolkit for the standard tests. And these are the real workhorses of the ER. You've got the chest x-ray, the CXR, which gives a snapshot of the lungs and heart. There's the ECG to check the heart's electrical rhythm. A complete blood count, or CBC, that can flag things like an infection or even anemia, not having enough red blood cells. And of course, that little clip on your finger, the pulse oximeter, giving that constant oxygen reading. Together, these give us the first hard data. And now we're at a crossroads. The doctor has the story, the exam findings, and the first batch of test results. Now they can start following specific leads to really zero in on a diagnosis. This is the point where all that detective work starts to pay off. It becomes a game of if this, then that. All the findings get combined, and they start pointing the doctor down one particular path. It's really like a logical flowchart. Let me give you an example. Let's say the patient has a fever, and their chest x-ray shows what's called a consolidation. That's basically just a hazy white spot where you'd expect to see clear black space for air. Well, you put those two clues together, boom, it points straight to pneumonia. Or how about this combination? The doctor hears those crackles in the lungs, sees the swollen legs, and notices those bulging neck veins we talked about earlier. All of those things are signs of fluid backing up because the heart just isn't pumping right. The diagnosis there? Acute heart failure. Sometimes the clue is so obvious you can hear it from across the room. If the big, standout finding is that audible wheezing sound, that's a direct signal that the airways are tightening up. And right away, the investigation is going to focus on either an asthma attack or a COPD flare-up. Okay, now this one is really dramatic. Imagine the doctor puts the stethoscope on one side of the chest and hears, well, nothing. Just silence. Absent breath sounds. That is a massive, massive red flag for a collapsed lung, a pneumothorax, and that is a true medical emergency. But here's what's really fascinating, and honestly, a little scary. What happens when those first tests all come back normal? The X-ray is clear, the ECG looks good, but the patient still can't breathe. This is where a doctor's real skill comes into play, because some of the most dangerous conditions, like a pulmonary embolism, are masters of disguise. They can hide from these initial tests. It just means the detective has to dig a little deeper. And that leads us right to the unsolved case. What happens when the first round of clues just isn't enough to crack the mystery? Well, this is when you call in the specialists, and they bring out the heavy-duty tools. We're talking about things like a point-of-care ultrasound, POCUS, which gives them a live video of the heart and lungs right there at the bedside, or a high-resolution CT scan that creates this incredibly detailed 3D picture. They might even do lung function tests to measure exactly how the lungs are working. These are the tools for the toughest cases. And really, this gets to the heart of the whole thing. This diagnostic process isn't just random guessing. It's a story of pure logic. It's designed to take a really scary, chaotic symptom and turn it into a puzzle that can actually be solved. So, what's the big takeaway here? It's that a doctor's approach isn't just throwing things at a wall to see what sticks. Every single question, every part of the exam, every test they order, it's a deliberate step in a logical sequence. It's all about getting to the right answer as safely and as quickly as they possibly can. Look, the human body is unbelievably complex, right? But the path to figuring out what's wrong is so often a story of pure, simple logic. It really makes you wonder, doesn't it? What other medical mysteries out there could be solved with the right flowchart?